Urban sanitation is capital intensive, and it means that we need to have in mega investments.
The fund came at a time where our understanding of the sanitation economy was a bit disaggregated, but it supported studies that helped us understand that there's actually money in the sanitation economy. For example, the study that was concluded about 2 years ago showed us that in the toilet economy, we have about $932 million US.
We have been able to, one, harmonize understanding of WASH. Not everybody in the urban councils has the same level of understanding of water and sanitation, or sanitation in particular. Understanding that urban sanitation is not only the containment. There's a component of emptying, transporting, and treatment. Two, how does the local government or authority support service delivery? How does the local government partner with the private sector provide emptying services?
We are supposed to empty as KCC, we are supposed to empty the toilets for the communities, but because we do not have the capacity, so we rely on the private sector, the private entrepreneurs, to help us empty in the communities, and then we take on the regulation role to ensure that they are providing services that meet the expectations along the chain, that is the transportation, and to ensure that they are delivering the fecal sludge to the designated treatment areas.
Men have been introduced to smell the money in pit emptying, supporting them, first of all, technically on how to safely empty latrines safely, but then also to understand the business they are in, to understand how the money can be made. So across about 4 towns, we've supported the incubation of such a private sector, and right now we are working on actually professionalizing them so that they're able to offer this service more professionally, but that there should also be an acceleration in their service.
After the training, we professionalized, or they taught us on what to do. Things became smarter. Actually, we used to do the rudimentary way of it. So we used to dig and bury. So we empty and bury on site. That was in the beginning, before this training.
Tukolera mbeere ennungi teri yakwennyala kuba wali ng'osobola okusaayo oludomola wansi ne luka mu suweji, omugwa ogulusikayo nalwo gutuddeyo mu suweji, ojja omukwatamu biki naawe ne weeraba nga okolera wafunyo.
We can advertise, we can do whatever we want. We are not fearing like the authorities, because we have all the documentations that we need to work.
Because there is a process that they go through to get the license. Of course, you have to get a clearance from National Water. If you don't have any cases that you've been dumping illegal waste into the drainages or the wetlands, then we can be able to issue an environmental sanitation service permit. Then that permit is what you will take to NEMA to be able to also do their part.
Now the central umbrella is currently operating 4 fecal sludge treatment facilities in Kayunga, Chiboga, Nakasongola and Chotera areas. So with support from Water for People Uganda through the Sanitation and Hygiene Fund, they saw a need to create more awareness for these services so that we can support some of these communities and provide these services.
The introduction of call centers to be sources of data will help us make better decisions, because these businesses that are conducted in the call center, when you aggregate that data, we have areas of focus. What are the problems in water supply? What are the problems in sanitation value chains? What needs to be addressed? Under this project, we were able to improve our coordination and harmonize our data systems between Ministry of Water, Ministry of Education, and Ministry of Health to make the WASH MIS. And it's communicating, and we are able to have national data in one place and do SDG reporting based on data we can all see and agree on.